Hello, my name is Anna Boland and I'm a registrar working with the Gastroenterology Department at Hull University Hospital, and I'm presenting a poster entitled Dietary Education and Intervention is Associated with Improvements in Overweight Patients with Undifferentiated Irritable Bowel Syndrome. As we're all aware, irritable bowel syndrome is one of the most common causes for presentation to gastroenterology clinic. Likewise, obesity is rising in prevalence, with up to 1 in 4 adults being classified as obese. Studies have shown that there is a higher rate of obesity in the IBS cohort compared to controls. And the aims of the study were really to examine whether those who were classified as overweight or obese responded differently to dietitian-led interventions for IBS management. The dietitian-led functional GI clinic in Tallaght intervenes with these patients in a two-step approach. First-line intervention involves diagnosis, education and advice. This second-line approach includes directed dietary changes, most commonly the FODMAPs diet. And a database of patients referred to the clinic between March 2014 and January 2020 was examined, and a cohort cluster analysis was carried out on a selection of these patients for whom we had data on their BMI at time of referral, which consisted of a total of 85 patients. Success was based off global symptom questionnaire, and of our cohort, 7 had a BMI of less than 18, 24 had normal range BMI, 22 were overweight and 32 were in the obese category. Diving into our results, of the 256 patients in the original database, 76% achieved success with the dietitian-led clinic. Of these, 55% responded to first-line intervention alone, and of those who went on to have second-line intervention, there was a 46% success rate. Looking into our cohort, of those in normal range BMI, 63% responded favourably to first-line treatment alone, without need for further intervention. And of those who went on to have second-line treatments, there was a 44% success rate. Of those with overweight BMI, there was a 41% response rate to first-line therapy, but a 77% success rate with second-line treatments in this cohort. Within the obese category, there was a 34% response rate to first-line therapy alone. For those who went on to have second-line intervention, there was a 57% response rate to this therapy. Moving on to our conclusions, overall there was an excellent response rate for all patients referred to these services, but those of a normal weight range appeared to respond very well to first-line intervention alone, with fewer requiring directed dietary intervention. Conversely, those in the overweight or obese category responded less frequently to first-line intervention alone, but appeared to respond very favourably to the dietary interventions. This could have serious impacts on triaging these patients as demands of the service increase going forward. Additionally, dietary interventions could be tailored to improve cardiovascular and metabolic health in this patient cohort. Overall, what this really just shows is how important a resource this is to us in Tallaght, and opens up the door for us to identify other patient characteristics for tailoring therapy. Thank you for your time, and I appreciate any questions.